All right, Larry, thank you for coming to speak with us today. Really appreciate that.
You're welcome.
If you would, give me a little bit of information about what your symptoms were like before you came to see me.
I've suffered from migraines my entire life. I've had them last as far as 45 days straight, and in that time you just take shots, pills, nasal sprays, anything you can to keep from to manage the pain of the migraines. And then they'd change a little bit, and then they would just come every couple days, maybe 3 times a month. And they were on a level, pain level 1 to 10. They were, 8s, 9s, 10s, completely decapitating. If you're driving, you got to pull over, get on the side of the road, find somewhere quiet, take a nap, take a pill, whatever it is you got to do. Take a nap at home.
Right.
But they were bad.
And you had tried a lot of different kinds of pills and shots before, right?
I've tried preventatives, and then the preventative medicine, that never worked. I've talked to, everyone and anything, and none of it worked.
Okay. And so when we first saw you, we thought it could be a nerve in your left temple. Mm-hmm. And so we did some nerve blocks, and we asked you to come in on days where your headaches were really bad.
Yeah.
And the nerve blocks really kind of turned the volume down on the pain.
It dulled the pain.
Yeah.
Yeah, it definitely dulled the pain. They helped.
Okay, and so based upon that, we decided to operate and decompress a nerve in your left temple. Mm-hmm. Tell me what your surgical experience was like.
The surgery wasn't, honest God, it wasn't that bad at all. I was, I stayed in bed for a day because my wife made me, just to make sure. But yeah, everything was fine. I was in bed for a day. I took a week off of work just because what I do for a living, it probably wouldn't be good. But I was back at work within a week. The swelling was down within 2. And all in all, the surgery was not bad at all.
Okay. And you're at this point 6 months following your operation.
Yeah.
And your headaches were getting more and more frequent before, 3 to 4 times a month,
Mm-hmm.
pretty debilitating. What are they like now?
Now I still get, I wouldn't even call it I guess it is a headache. That's kind of probably what most people feel compared to what I used to get. I still have the sensation there. You could feel it, but I have not taken any strong medication since the day of the surgery, so I don't have to do that anymore. And I've gotten a couple little headaches that were managed with 2 aspirin.
Okay, and you're on a scale of 1 to 10. What would you rate those?
1.
1 or 2, and
1 or 2 compared to what we used to have.
And are you able to do more things than you used to be able to do?
I've started getting back in shape and getting out in public a lot more because I don't have to worry about getting a migraine while I'm out and about now.
Good. So would you do it again if you had to?
Absolutely.
Yeah. And can you turn your head to the side so just we can see where the surgery is?
So it's actually right.
Yeah, right there. You can barely see it. All right. Well, thanks for taking the time to talk with us. Really appreciate it.
Thank you.